Let me first congratulate the Ministry of Fisheries for successfully securing a 25 million grant from the G20 Pandemic Fund for the implementation of the Animal Health Security Strengthening in India for Pandemic Preparedness and Response Project. This is a remarkable achievement, and this is greatly appreciated by all of us. Secondly, let me congratulate the Ministry of Animal Husbandry for launching the 21st livestock census operation, which is a unique initiative. Ladies and gentlemen, last year during India's G20 presidency under Prime Minister Modi, the linkage between climate change and health had a very high mention, and the emphasis by the Prime Minister on One Health approach was laid emphasis on. We recognize the interdependence of human, animal, and environmental health in preventing and controlling disease outbreaks. Today, we have moved a step forward with securing a grant from the Pandemic Fund. Animal health security is critical as it is directly connected with human health. Many zoonotic diseases originate in animals, and as the Secretary pointed out, India is unique because it has a one-to-one direct relationship. So strengthening animal health directly contributes to preventing human pandemics. It has an economic impact because animal diseases can severely affect the livestock industry, which is a key source of income for millions of Indian farmers and key component of food security. Healthy livestock contributes to a reliable supply of dairy, meat, and other animal products, ensuring food security for the population. But we face key challenges in animal health security which need attention. Logistical challenges given India's vast geographic and cultural diversity, and therefore we need animal health security system across the country, and this is a key task that needs a detailed action plan. There is a lack of awareness. Rural areas, which contribute 65% of India's population, we need to create awareness of disease control measures and how to treat illness of animals. And there is a shortage of veterinary workforce, which is very critical. There are infrastructure gaps in terms of veterinary infrastructure, particularly in terms of diagnostics and cold storage facilities. And there are funding constraints or ongoing vaccination drives, disease surveillance. All this will be addressed through this fund. Ladies and gentlemen, we will be able to enhance our institutional capacities, improve risk communication, and establish robust surveillance systems through this pandemic fund. The One Health approach is an integrated, unifying approach, mobilizing multiple sectors, disciplines, and communities. We need to work together to foster well-being and tackle threats to health and ecosystems. We need to implement the One Health approach, which calls for 4 C's, namely communication, collaboration, coordination, and capacity building. This thematic area is very crucial for all, and COVID-19 established the importance of One Health. Ladies and gentlemen, India's G20 presidency prioritized health emergency prevention, preparedness, and response. It prioritized One Health as a very important component of health emergency management. Ladies and gentlemen, India has institutionalized One Health at the national, state, and district levels, and we need to promote huge amount of collaboration. We are the only country which is working with WHO, FAO, WAH, and UNEP, and we've received huge support and enthusiasm for all this. They are in sync with our thoughts on digital surveillance, which encompasses climate data, human health data, and animal health data. Ladies and gentlemen, with the onset of the triple planetary crisis, climate change, biodiversity loss, and pollution, the inextricably linked infectious disease threats emerge, which not only put our health systems under a lot of pressure, but also one of the major global health challenges. There is therefore a need to streamline international policy and build resilient health systems. Hence, it is important to connect One Health to the challenge of climate change and its impact on human health. As climate change has worsened several health risks such as water and foodborne diseases, vector-borne and rodent-borne diseases, we need to impact the social determinants of health they are all impacting the social determinants of health by causing shortage of food, water, and loss of livelihood. Today's launch of this animal health security will strengthen the pandemic preparedness and response project, and this is a very crucial element of India's national health security framework and reflects India's proactive measure to mitigate the risk of future pandemic through a very comprehensive and integrated approach. I take this opportunity of congratulating the distinguished ministers and the ministry for launching this very unique initiative for animal health security in India, and I wish them all the best and all success. All the G20 countries will collaborate with the Ministry of Animal Husbandry to ensure its success on ground. Thank you very much, ladies and gentlemen.